Hello, welcome to my March message. The first thing I want to talk to you about is SLM, Service Line Management. We recently wrote to you regarding our decision to move from borough-based management to service line management, and the reason we've done that is that we feel that this will improve the services that we provide for patients. We've looked at all the evidence that there is available and worked with our clinical leaders, and we're really confident that moving towards this system is the right approach for universally improving the quality of care that our patients receive. So I'm very pleased to announce that we've made our first appointments now to the new service lines. That includes clinical directors, it includes lead nurses, and it includes general management. And we will be sending you details of who these people are shortly. From the 1st of October, we will be moving to completely smoke-free across the entire trust. And this will mean that both wards, hostels, all of our buildings and services will be completely smoke-free. There will be no more designated smoking areas, and smoking will not be permitted in any premises or on any grounds owned by the trust. This will apply to visitors, it will apply to staff. We will, of course, be offering a lot of support during this period, offering our patients and our staff who want to quit or temporarily stop free smoking cessation support. So I think it's really important that we make this move and we become completely smoke-free, and we support people to stop smoking. We know that people who've got serious mental health problems also have poorer physical health care, and people often die earlier than the general population, and some of this can be accounted to smoking. So we're really keen to try and improve the physical health care of people who use our services, and stopping smoking on our sites and helping people to stop is a major factor in terms of improving health. If you'd like any more information on this, we've got an event that's held on the 6th of April between 9:30 and 11:30 at Springfield Hospital. There's more information on the site about how you can access that. So another thing I want to talk to you about is car parking. We're currently undertaking a consultation until the end of March regarding changes to our car parking policy. And car parking is a pretty emotive subject at any time, but last year we increased car parking charges for visitors, but not for staff. We're now proposing to increase the staff car parking charges from £12 a month to £20 a month. And despite this increase, we will still be the lowest charge in London on NHS Trust for parking. And whilst we have lots of car parking currently at Springfield, over the next few years the number of car parking spaces available will significantly reduce as we implement our new estate modernisation programme. We build a new hospital, and there are about 800 houses built on this site. So it's possible that we will have to start reducing car parking from probably May 2017, and the exact numbers will still be determined on the overall planning guidance that we have for the site and what the buildings will look like. We are of course looking at how we can get more long-term sustainable ways to manage car parking, increase alternative car parking options available to our staff, setting out a travel strategy that looks at alternatives to driving to work. We offer showers, we offer bike facilities, and just helping staff with season ticket loans and cycle to work schemes. But of course, a lot of people still reliant on cars, and our staff as well go in and out from Springfield and Tolworth to work in other places. I will let you know what the outcome of the consultation is in my April newsletter. So we're really proud to be the first mental health trust in the country to have been awarded the British Deaf Association's British Sign Language Charter. That's obviously a lot of things to say in one sentence, but it's a recognition of the work that we've done to really help to get sign language and communication better for people that use our services who are deaf, but also in how we support carers and how we promote deaf culture and language across our services. So on Monday the 13th of February, over 60 people attended an event at Springfield, including deaf service users, carers, staff, and the British Deaf Association chairman, Mr. Terry Riley. So it was great to recognise our achievements in deaf services, and this is a really specialist services, and we're proud to be able to provide this. As you probably know, people come from across the country to our services, and there's a real sense of pride in the services that we provide here. You can of course find out more about our deaf services on our website. So a really important area that I want to talk to you about is about our policies and procedures. And we've had a number of incidents lately that have resulted from staff not following our own policies and procedures. And I really want to reiterate to you all the importance of following and working to policies. So the policies that we have are there to protect patients and provide safe services, but they're also there to protect staff as well. And as I say, it's really important that you follow these policies and procedures. If you're not sure about things, you must ask your manager, you must ask your supervisor, but please make sure that you have looked at what policies are pertinent to your area, to your ward, or to your team, and make sure that you follow them. I also want to talk to you about the staff survey. So the staff survey for the whole of the NHS has just been published, and we've got our results. And when we look at it from compared to last year, we had more people have completed this survey. So over 50% of you completed the survey this year. And thank you very much to those of you who did so. It gives us a lot of information that we can use to look at how can we improve things within the organisation, and how can we improve the experience for staff who work with us. So we've seen a number of areas where we've improved from last year to this year. The number of you who feel that there are high quality appraisals in place has increased. You also feel that there is a fair and effective system for reporting errors, near misses and incidents. More people are saying that they feel that there is effective team working, and more people feel that there is good staff motivation in the organisation. And indeed, we're above the national average for mental health trust for this. So it's undoubtedly been a challenging time for the NHS and our own organisation in the last year, and the results of the survey have broadly remained the same as last year. So clearly means we've got more to do, but I think that there's a really good sound base now for us to build on and go forward. Going forward, we are going to look at a number of areas where we want to improve, and these include improving equality and diversity, and also improving the health and well-being of our staff so that people feel that they are more supported at work. So going forward, we will continue to focus on a number of areas, including equality and diversity, and also the health and well-being of our staff. We will be working in partnership with the Employers Network for Equality and Inclusion, and also Stonewall. At the end of March, the CQC are coming to visit and do a focused inspection on issues regarding the Mental Health Act. So it's not the same visit that we had last year from the CQC. It's a focused visit specifically looking at areas around detention and the use of the Mental Health Act. Now the CQC do these focused inspections from time to time. They're not just looking at our trust, they're looking at a number of trusts across the country. And what they're looking to do is collect data on a national basis, but also look at some of the areas that are maybe areas to improve locally. So they're specifically going to be looking at the performance and the processes for how we use compulsory powers. How do we use the Mental Health Act to detain people? They're going to be looking at any increases or decreases in such use of the Act. They're also going to look about how the approved mental health practitioners, known as AMPs, are working, and seek to understand changes to these, again, what's happening nationally and what's happening locally. So they'll be visiting the Trust on the 27th of March, and they'll need to talk to a number of you, people who are involved in the detention process, in sectioning people. So they'll be wanting to meet with ward managers and nursing staff as well. There's a lot more information that's available. It's on Inside, but specifically from Christopher Merchant, Head of Social Worker, and Vanessa Ford, who's Director of Nursing. They will be giving you more information and sending out a timescale in the next few days. And finally, I want to talk to you about the 2 crisis cafes that we're opening in partnership with third sector organisations. I've spoken to you about these before, but I'm really pleased to say that on the 1st of April they will be formally opening. And these cafes are going to provide an accessible and normal environment where people can come in the evenings and weekends and get some support, receive peer support and other support, and it's really designed as kind of an alternative to people having to go to A&E or seeking other help. The cafes will provide what you would expect in a cafe: hot and cold drinks, support, range of activities for people to try and help support their crises. They'll be supported by the Trust's crisis home treatment teams, and when clinical intervention is needed they can provide that. So there's going to be 2 cafes, one in Tooting, one in West Wimbledon, good transport links to those, and they're just one of the range of other alternatives that we're putting in place to try and help to manage the demand on beds.